Hello, everyone, and thank you for joining us. I'm Lauren Reynolds with At Home Nursing Care, and this is one of our training programs. The topic today is what is ALS? And our instructor today is our fabulous clinical director, Crystal. So Crystal, why don't you say hello?
Hi guys, it's Crystal, the clinical manager. You guys talk to me a lot about the clients. It's good to see you.
Okay, perfect. So let's get right into it. I'm going to share my screen here. And Crystal, just remember to be very close to the microphone.
Okay.
Take it away.
Okay, here we go. So I'm going to talk to you guys today about ALS. You may or may not have heard of it. It stands for amyotrophic lateral sclerosis. This is a devastating disease. You might remember the Ice Bucket Challenge back in 2014. That was started by Pat Quinn, a young man who was diagnosed at age 30 and decided to raise awareness because not a lot of people know about ALS, or it didn't know then. And it ended up raising over $250 million worldwide, which is pretty impressive. You might also know ALS as Lou Gehrig's disease. Lou Gehrig was a baseball player in 1903 that played 17 seasons with the New York Yankees. He was forced to retire after developing the disease in 1939 and passed away just 2 years later. So what is ALS? Amyotrophic lateral sclerosis. It is broken down into Greek meanings. A means no, myo stands for muscle, and trophic stands for nourishment, so no muscle nourishment. Lateral just refers to the area of the spinal cord where the nerves are sent out, and sclerosis equals hardening. So as the nerves degenerate, it leads to scarring or hardening. You may have heard of multiple sclerosis or a lot of diseases where that sclerosis means hardening. What is ALS? A neurodegenerative disease, meaning cells. I'm just realizing I can't see the rest of the screen. I've lost you for a second. Nope. Sorry, technical difficulties. There we go. How do I get that? There we go. Thank you.
No worries.
Kathleen,
just edit that part out for people who are watching it on video later.
Oh, good. Okay. So it is a neurodegenerative disease, meaning cells of the nervous system, specifically the motor neurons, die over time. So in ALS, this makes the brain stop talking to the muscles, causing increased paralysis. So you can imagine this is a very devastating disease. So as the motor neurons die, the brain's ability to initiate and control muscle movement is lost. And ALS affects the muscles that affect voluntary movements specifically. Their ability to speak, speech is controlled because of the tongue, eating, moving, and eventually breathing. So these images are to depict a normal nerve cell, what they look like on the left. On the right, you see a sclerosed nerve cell, and it makes the muscle have difficulty contracting. So there are two major types of ALS. Less common is familial ALS, where it's up to 10% of all ALS cases only that are an inherited disease. Children of ALS patients have a 50% chance of inheriting the gene mutation that may develop the disease. So you can imagine not only are you receiving devastating news, when you're diagnosed with ALS, but if you have children, you also have to think, wow, my children have a 50% chance of having the gene for ALS as well. And then more commonly is sporadic, which just means we don't know where it comes from. It can affect anyone of any age. And that's up to 90 to 95% of all cases. And so while certain age groups are more common, it can really affect any of us, which means it's important for any of us to know about. Characteristics of ALS. So it usually strikes people between ages of 40 and 70, but it can often affect younger people. People are often in their 20s and 30s when they're diagnosed. And 16,000 Americans have the disease at any given time. Something I found significant is 1 in 300 people will receive a diagnosis in their lifetime. So that makes it sound a bit more common. Something unusual is military members are twice as likely to be diagnosed as average Americans, and the reasons are unknown at this time. 5,000 people are diagnosed annually in the US, and so that's just each year, but then many more are living with it. Average age of diagnosis is 55, 20% more common in men than women. So men tend to get it more than women do, but we're not sure why. And oftentimes it can be difficult to diagnose. It can be confused with other diseases like MS, and it can take a while to get to diagnosis. And then by the time you're diagnosed, the life expectancy for ALS is not great. At 2 to 5 years is what they're given, although some people can live longer. So they say 50% of people live 3 years after diagnosis, 25% live 5 years or more, and just 10% will go on to live 10 years or longer. And there's no cure. So even though people might live longer than the 2 to 5 years expected, their quality of life can be very compromised, as you might imagine. There are some drugs that can help treat symptoms, or there have been a couple drugs that will help and maybe extend the life 2 to 3 months. It's not, when you're looking at a 2 to 5 year prognosis, 2 to 3 months when you're hanging on to every day can mean a lot. So it's worth considering, but short term for sure. The riluzole is a medication that blocks the release of glutamate, which is an amino acid, and it delays ventilator dependence, and tracheostomy just means they keep their quality of life a little bit longer and may extend survival by 2 to 3 months. And Tiglatec at the bottom is the oral suspension version of that. Nuedexta is used to treat pseudobulbar effect. This can occur with some ALS patients, not all, where they have uncontrollable laughing or crying. I heard someone talking about ALS and saying that her patients sometimes don't mind the uncontrollable laughing because it helps lighten the moods of the family. It's like, we kind of like that part, but the uncontrollable crying, you can imagine, might be disturbing. And lastly, Radicava is a Japanese medication that has the most significant effect in studies that is shown to slow the decline by maybe 33%, which is pretty significant. However, it's really hard to get this medication administered. They have to go in for IV infusions for 1 hour, and they have to be done daily. So they might do it for 2 weeks every single day and then 2 weeks off. So it's a taxing, and they it's very expensive, as you might imagine. Yeah. So the causes of ALS are unknown. Research is ongoing. This is why people with ALS feel it's so important to continue research. There have been a few breakthroughs on finding some genes that may be related, but no pinpointed cause. It's thought that maybe environment plays a role in people getting this. Higher prevalence in military veterans suggest some sort of chemical or environmental link. How does ALS start? Well, it's different for everyone, and each person is going to have their own story, so it's not always clear. Again, it's difficult to diagnose, but I've heard and read it often starts on one side of the body. So they might get muscle twitching or weakness in their hand, and then it progresses to dropping things or falling more often. If you're 27 and you find yourself suddenly falling all the time, you think something is off. I need to go get this looked out. And then they have to go through the differential of all the potential diseases that can be eventually leading to ALS diagnosis. So ALS symptoms are driven by motor neurons. So things that are not affected are sensory. So sight, touch, others, hearing, taste, smell. So just know if you're caring for a patient with ALS, that even though they cannot move their legs or their arms, maybe, they can still feel them. So it's very important to be conscious of that when you're mobilizing them or doing anything with them that might cause them pain or discomfort, especially if they're having trouble communicating and they're not able to speak. They're going to rely on you to notice if they're grimacing or showing any other signs of pain. What is affected by ALS? So imagine you're a 20, 30-year-old and suddenly you start losing control of your speech. So you might hear some ALS patients talking and they can't enunciate, or their speech is really soft-spoken, and eventually they need devices to help them speak. And muscles in their arms, hands, legs, feet, there's no specified pattern of progression that applies to every patient. Progressive muscle weakness and paralysis, though, are universally experienced. Breathing loss in the final stages leads to permanent ventilator support should the patient decide to use that. They won't be able to breathe on their own. This is a YouTube video we'd like you guys to watch of Summer Wisman, who was diagnosed with ALS at age 32. In 2015, at age 36, she had lost her ability to walk, speak, or move her hands. She died in 2016. So you'll get to see the type of device she has to use to communicate.
Am I afraid of dying? No, not really. I know it's coming. It's just strange to have death lurking around the corner like my creepy stalker I had in Japan.
As you say, you're not afraid of death right now. How much do you think about it?
I don't know, really. It's just there all the time, and I probably think about more than I realize.
Do you still experience joy in your daily life?
Yeah, I love being with friends and hanging out with my family. I try to just go with the frustrations and look forward to events with friends and when strangers come to interview me.
What's it like for you when friends come and tell you about all the things that they're doing in their lives that you know you can't do anymore?
I'm happy for them. My good friend Chelsea just recently got engaged, and I am genuinely happy for her. But when I'm alone at the end of the day, I do think about the milestones I'll miss out on. I have decided to use death with dignity. As I mentioned earlier, I didn't want to rely on tubes or machines to keep me alive. My breathing is getting worse, but I feel good. When it gets to the point when life becomes unbearable, I will take advantage of the law. It's difficult to say, this is the date I want to die, but I'm confident that I know when it's my time to go.
What do you most want people to know about you?
I want people to know that I am a storyteller who happens to have ALS.
I do encourage you guys to watch that YouTube video just to get an idea of what the ALS picture looks like. And though people may not be able to speak clearly or they speak really slowly, it doesn't always indicate or mean that they have any neurocognitive decline. They may be fully with it and aware, and just their speech and everything is slowed. So ALS symptoms, we'll go on to the next slide that'll kind of specify each of these. So progressive muscle weakness, tripping, dropping things, abnormal fatigue in the arms and the legs. So just something as simple as picking up a glass of water takes a lot of focus and energy. So everything that they do is just exhausting to them. Slurred speech, muscle cramps and twitches, uncontrollable periods of laughing and crying. That's that pseudobulbar effect that happens in some patients. So behavioral changes, it used to be thought that there were no behavioral changes, but about 15, 20 years ago, they realized, no, it does affect up to 50% of people with ALS, and half of them do experience a change. 15% will go on to develop a dementia, a frontal lobe dementia, but more often they do not. Can be related to ALS itself or other factors like not enough oxygen in the later stages, depression, anxiety, sleep disturbances, and medication issues. Common changes when cognition is affected by ALS is embarrassing childlike or inappropriate behavior, loss of their filter, so they just spurt up everything that comes to their mind, loss of table manners, eating only one type of food, like preferring sweets, for instance, poor decision making, there can be affected, inability to concentrate, difficulty remembering, fixation on a single activity or idea, sometimes saying no when they mean yes, writes or says words in the wrong order, loses the ability to smell and can't follow instructions anymore. So as a caregiver, something important to know about reacting to these behavioral changes is that knowledge is key. So if you do get the privilege of caring for an ALS patient, just the more you can learn about the disease, and in particular, remembering that each person is different, is key. A lot of people that, the hardest part, like our elderly patients, is slowly losing their independence. And so whatever you can do to maximize their sense of independence will help. Also, not treating them like a child, that often gets done because they're losing these things. So you want to try to maintain as much sense of independence and respect as you can. And counseling can help. Environmental changes to promote calm can help with their anxiety, and realistic expectations for family and caregivers, setting those. Going back to the pseudobulbar effect, it can lead to uncontrollable laughing and crying at inappropriate times, difficulty suppressing their emotion. Something important to know about this is it's not a psychological issue. It is a nerve issue in the brain. The brain is not able to communicate. So the reflex no longer working correctly may not involve any other cognitive changes. And it can be treated with medication like that Nudexta. Recommendations for you as caregivers are to simplify communication, break up sentences into short phrases, asking yes or no questions, any ways you can help promote good communication, slowing down when you're speaking. Non-verbally, you can write down 2 choices and have the person signal to the choice they prefer with their eye gaze. So that's something that's not affected, is their ability to their eye gaze. And so that's the way they communicate later in later stages. Set realistic expectations for the ALS patient, meet the person at their level of comfort or ability, contact the local area ALS association for help before feeling overwhelmed. So you can encourage them or the family to really reach out before it gets to those later stages where they don't know what to do. Another great resource is IamALS.org. They have a lot of great resources for patients, and it is patient-led. Discontinue potential dangerous activity, because that can happen, especially with the patients that suffer from dementia. Excuse me. So nutrition with patients with ALS is critical. ALS patients tend to lose weight because they're having difficulty swallowing. That often leads to less appetite, and so they have difficulty maintaining their weight. A lot of people eventually go to a tube feed. Well, they have it, if they're having a lot of trouble swallowing and getting in that nutrition, then they will get a gastric tube or a tube into their stomach that they can put their food in. But anyway, so if your patient is eating, it's important to try to get as much good nutrition, high calorie in as you can. So we are promoting more calories as much as we can to maintain the weight. And that has led to prolonging their life. People that were diagnosed with ALS a long time ago would die sooner because they were malnourished. And some patients with ALS can actually become, they don't know why, but their metabolism starts working extra fast. And so they need like 2,000-3,000 calories a day. Weakened muscles make eating difficult. So these are reasons that nutrition is a challenge. Loss of hand or limb coordination, so they can't quite get their spoon or fork up to their mouth. Chewing and swallowing food is harder, so it takes more energy and time. And so they're worn out by the time they've had a few bites and don't want to eat more. So risk for aspirating food or liquids in the windpipe or lungs. So pneumonia or aspiration pneumonia was also a big cause of a death in people with ALS until they started implementing the option, at least, of getting a gastric feeding tube once they've reached that point. Other challenges include fatigue, constipation, loss of appetite. Caloric intake diminishes as ALS progresses, while weakened muscles increase need of more calories. So that's when the feeding tube may be considered. And they encourage that feeding tube be considered before losing 20 to 30 pounds. You know, you want to always try to maintain the weight. So monitoring their weight is important. Just some suggestions for nourishment, what to feed your ALS patients. As this is compiled by the Stony Brook dietetic interns and updated in 2012. There's a lot of great resources online, but softer foods like pancakes, oatmeal, eggs, avocado, French toast, those are foods that once in the earlier stages when they're starting to have difficulty swallowing, you can try those, but definitely be sure to clarify with the family or the physician what the current order is. Also soups, the idea is to get in a lot of calories. So soups that are cream-based are the go-to, just so you can, if they're only eating half a bowl of soup, at least they're getting higher calories. So things with milk, or sometimes people will use cashews as an alternative to get those calories in and nutrition and make it creamy. So those are just some suggestions there. Main dishes might be an easy lasagna, chicken meatballs with gravy. Gravies are good just for the higher calories. So gravies and sauces, salmon recipe quiche, veggie mac and cheese to add in some veggies with that, cheese grits, chili. Desserts are pudding, parfaits, snacks. Those are just some snacks ideas. Again, just high calorie, softer foods. Smoothies are a good option where you can pack in a lot of nutrition and it's generally easier to eat. Something else to know that a lot of times people don't realize that if any of your patients, even your elderly patients, are having trouble swallowing, oftentimes it's more with the liquids, like thin liquids. And so you'll see your patients get thickened liquids. That thickened liquids you might think would be harder to swallow, but it's actually the thin liquids like water that are the hardest to swallow. So physical activity and ALS. So we have exercise goals. The goals are to maximize muscle function, slow down the deterioration of range of movement, and increase aerobic capacity and endurance for as long as possible. With people with ALS, it's important that they don't overexert themselves when exercising, because as you and I might have a goal of experiencing muscle soreness, that is a sign of the breakdown of muscle, and for them that leads to more inflammation and can progress their disease quicker. So also walking and cycling. If you can still balance well, you can walk or use a recumbent bike, you being the patient, and you as the caregiver can help them do this 20 to 30 minutes a day, or following the guidelines from their physician, or if they have a physical therapist. This can be broken up into 10-minute segments so that it doesn't lead to that soreness and breakdown of muscle. Weight training is a good option for them with light weights a few days a week, preferably not on the days you walk or cycle. So doing it on opposite days will also help build muscle strength. As the disease progresses, you'll find that you need to use lighter weights and do fewer repetitions, and that's okay. Just keep doing them. And stretching is important, both static and dynamic. Once a day or twice a day will help ease muscle pain and slow the decline in your range of movement. So if you're taking care of an ALS patient and they are becoming stiff, it's really important to do those range of motion exercises to prevent muscle stiffness. And those exercises, you can find them with a quick Google search online to look up range of motion exercises. Those are important to do with any of our clients that aren't moving on their own very much. So only moderate exercise is encouraged, not very strenuous. Some people think you go harder, it's better, but not for ALS patients. Soreness is the breakdown of muscle, which is not good for them. Like we said, listen to your body, or have the patient listen to their body and not push it too hard. So each person is going to have their own limit. Excessive exercise may lead to adverse effects. So living with ALS, where to get help? A lot of this was derived from ALS Association. So you can find that at alsa.org. I told you about the IamALS.org organization that was started by Brian Wallach, who is an ALS patient himself. He was diagnosed in his 20s. He worked for President Obama. He just, has young children and has a lot of motivation, and he has developed that organization to be patient-led. So there's a lot of great resources on that. Also looking into your local ALS chapters, ALS Centers for Excellence, and UCSD Health more locally. I also found a really interesting podcast. I'm sorry it's not linked here, but it's called I Am Dying to Tell You. And Lori Carey is the woman that is doing this podcast, and she is an ALS patient herself. She's actually been lucky that it was slow progressing and lived 17 years, but she brings on a lot of ALS patients to tell their story, and it's really interesting. So if you want to learn more about ALS, go to any podcast website or her website, but I Am Dying to Tell You podcast.com. Other things to look into are the technologies that we have currently that's always progressing to help ALS patients communicate or function. So assistive devices like the eye gaze and the G-tube, J-tube, those are the feeding tubes. Also learning how to operate the wheelchair and Hoyer lifts, helpful as a caregiver. So the value of ALS research is, you might think, a lot of people think, oh, it's not that common, but it is 1 in 300 in their lifetime. It's pretty common. And then because it's a neurodegenerative disease, a lot of the research also applies to others like Alzheimer's and Parkinson's. And so if we find breakthroughs or medications that will affect ALS patients, it might also likely cross over to affecting those types of patients as well. Thank you all for joining me today on ALS, and I hope it's inspired you to learn more.
Thank you, Crystal. What a great presentation. And this is designed as just a preview, an introduction to ALS. And we have another training that will go along with this one that you'll be able to find on our page and on our training site as well. So we really appreciate your expertise and your time. And yeah, I'm somebody who actually knows a person, a younger man who is diagnosed with ALS, and it's amazing how quickly it progresses once there are physical signs of it. So it can be devastating, but the more information we have about it, the better quality of life we can provide to people who are affected, and that's extremely important. So thank you so much. I appreciate it.
Thank you.
Okay, so this is Lauren Reynolds from At Home Nursing Care, reminding you to be well, age well, and always use your powers for good. We'll see you next time.